This is the E-Ranger ambulance. It's used to get into difficult to reach communities, to get people into health centres so they can be treated safely. It's also being used in around 20 different countries, including northern Uganda, where it's being used to get pregnant women to hospital so they can give birth rather than at home. Its inventor is Mike Norman. He's a British engineer and motorcycle enthusiast, and this is your latest invention. Just tell us what this is.
Well, this is based on the E-Ranger ambulance, and it's a mobile clinic. So what it means is that the staff from the fixed clinics can actually venture in to the bush, some 20 kilometres away even, to give health services to the people in rural areas.
OK, so just talk us through what we've got here and how it's used.
You've got things like we can do vaccinations with cold storage and needle destroyers. We can do blood pressure checks, general healthcare checks, much the same as you could do in a fixed health centre. Weigh babies, weighing scales, baby weights, even small surgery can be done with suitable, medical team out on the bikes.
Okay, and why is a service like this so important?
Well, the difficulty is for people in rural and out areas to get to health centres. 20 kilometres, if they're sick or feeling a bit rough, can take 10 hours. So by getting out there with the bikes, which you can do in an hour or so, you can give the community a healthcare service on a regular basis.
Okay, and tell us about the bike itself. You've obviously needed to do a lot of adaptation.
Yes, we do a lot of modifications to make the bike durable to deal with the hard terrain. Modify suspension, tyres, gearing, etc. So it can get to the places where even 4x4 sometimes have difficulty.
Okay, well, this costs around $6,500. It's being piloted in South Africa at the moment, but it's hoped these sorts of innovations that get services into the community relatively cheaply can be used right across the developing world to help save lives.